exactly is depression? Consider depression to be your mood's weather forecast. Monday will have a 100% chance of clouds and showers. Tuesday, as well. Wednesday appears to be just as bleak. In fact, the next 2 weeks will be filled with storms. You're stuck in this bad weather pattern, and there doesn't appear to be any relief in sight. You may feel isolated, but you are not alone. Depression, often known as major depressive disorder, MDD, is one of the most common mental health diseases, affecting an estimated 350 million individuals of all ages. Now let's get one thing straight: depression is not the same as sadness. It's common to feel down or unmotivated sometimes, but depression is more persistent. It also has a genuine biological basis. It's a severe mood condition that can have a detrimental influence on your health and quality of life, as well as those around you. The Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, is used to make the clinical definition. A 2-week period during which a person had a sad mood or loss of interest or pleasure in daily activities, as well as the majority of specific symptoms such as issues with sleep, food, energy, attention, or self-worth. This definition excludes grief that occurs after mourning. As many as 2/3 of people suffering from depression try to grin and bear it. They don't seek or receive the treatment they require to manage it, and those who do sometimes wait months before bringing it up with their doctor. If left untreated, depression can last for years, causing physical symptoms and even suicidal thoughts. Even if an episode ends on its own, it may recur. Happily, the stigma associated with mental health issues such as depression is dissipating. Furthermore, with depression screening now available in primary care, the goal is that more patients will be able to get the therapy they require. What is the frequency of depression? Major depression is one of the most prevalent mental diseases in the United States. According to a 2017 report by the Substance Abuse and Mental Health Services Administration, an estimated 17.3 million adults in the United States experienced at least one major depressive episode in a year. That equates to 7.1% of all adults aged 18 and up. Women are more likely than men to undergo a major depressive episode, 8.7% versus 5.3% for adult males. Depression is extremely devastating in the workplace. According to the World Health Organization, it is the biggest cause of disability globally. The entire economic impact of MDD in the United States is estimated to be $210.5 billion per year, which includes expenditures related to missed days, lower productivity, depression treatment, and suicide. What factors contribute to depression? There is no single cause of depression because it is a result of a combination of genetic, biochemical, environmental, and psychological factors. These are some examples. The physical structure or chemistry of the brain scans show that some people with depression have a smaller hippocampus, which is involved in long-term memory. According to research, chronic stress can hinder the formation of nerve cells in this area of the brain. The serotonin levels are out of whack. Another thing going on in the brain that may be related is that serotonin receptors behave differently in people who do not have depression. This is why some antidepressant medications work with serotonin. There is a familial history of depression. Someone who has a parent or sibling with MDD is twice as likely as the average person to acquire depression. The genetic code is unique. When you are born, each parent gives you either a short or a long gene. They are known as alleles. It turns out that having one or more short ones is associated with a greater predisposition to be depressed when something awful happens. Other disorders or associated mental health concerns in the past. Depression is frequently related to or can be perpetuated by post-traumatic stress disorder, substance use disorders, and learning difficulties. Anxiety is a major issue. Up to half of patients with depression also have an anxiety problem. Life occurrences that are stressful or significant abuse, financial problems, the death of a loved one, and job loss can all lead to depression. Even happy events, such as a major move, marriage, graduation, or retirement, might make you feel gloomy. For one thing, these events disrupt your routine, but they might also elicit the sentiment that whatever achievement or happiness you are experiencing is undeserved. Hormone levels fluctuate. Menstrual cycles, pregnancy, and childbirth can all result in spells of depression. Some health problems, like headaches or pain that doesn't go away, have been linked to depression or may make it worse. Some drugs, such as sleeping pills and blood pressure medications, can also trigger depression symptoms. Thus, if you're feeling down, always get help. Don't go it alone. Always seek expert assistance, and for more interesting topics, follow us on newstoday.nyc. Also follow us on YouTube News for today's reviews. Thanks for watching. www.newstoday.nyc. Subscribe.